So we're going to try and see if we can finish by 1, because there's a John Lewis special that starts at 1 o'clock. I want to make sure people have a chance to tune into that. We're going to start by providing an update on our Stop the Spread testing initiative, including the details on the next round of communities that will be launching free asymptomatic testing with our support. But first, I do want to give a daily update on where we are with COVID-19 testing, cases, and hospitalization. Yesterday, the state reported that almost 10,000 new individuals were tested for COVID-19. In total, over 1.4 million tests have been administered in Massachusetts. On Sunday, there were 273 new positive cases reported, which brings the statewide total to just over 108,000. The 7-day average for the positive test rate is 1.9%. The 7-day average positive test rate has now been below 2% for well over a month. Positive test rates have ticked up, going from about 1.7 to about 2%. Obviously, we would prefer to see 0 new cases of COVID, but we know that's just not going to be the case until we have a medical breakthrough like a vaccine. We're closely analyzing the data for trends, but right now we are aware of some small clusters that are associated with gatherings. Obviously, there was a lot of public reporting on the cluster that took place after a private party in Chatham, and there's recent information about an employee at Bay State Healthcare who went to a hotspot state, came back, and was lax with respect to wearing a mask, and there are now a number of people who work at Bay State and a couple of patients who were there as well who tested positive. Our contact tracing efforts continue to be hard at work to isolate these events as they become available, and to make sure that we work hard to ensure that the folks who are affected by this isolate and are supported in that isolation. We can also assume that there's simply a lot more mobility out there, some of that as a result of the economic activity that's associated with opening up some of our Commonwealth's businesses and employers, but some of it's also just people being out and about. It's warm out. And people, generally speaking, are probably in more contact with people now than they were in the months of April, May, and even June. We should all remember where we were when we started this reopening program in May. We were seeing positive test rates at that point that were north of 10% on much fewer tests. That's why we can't say enough about how important it is that until we have a vaccine, that everybody continue to play their role. And when we let our guard down, the vaccine will, or the virus will make gains. To repeat that again, if we let our guard down, COVID will take advantage of that, and the virus will not take the summer off, and neither can we. There are currently 364 patients who are hospitalized for COVID-19 statewide. 56 of those are in the ICU. Those numbers, which is based on a 3-day average, is down about 90% since the middle of April. 2 hospitals are currently using surge capacity. Here in Massachusetts, the public health data continues to be stable, and many of the key stats have improved significantly since the height of the outbreak in the spring. That's because people did the things that we all needed to do to slow the spread. People were wearing face coverings, practicing social distancing, and maintaining good hygiene and cleaning protocols. Our success has been driven by our continued efforts to increase testing capacity in every corner of the Commonwealth. As we look ahead, we want to continue to increase access to testing so we can better understand where the virus exists and track new cases and stop and slow the spread. Increased testing allows tracing for those close contacts of confirmed cases so people can isolate and we can prevent further transmission. While the Commonwealth's made real progress to increase testing capacity and to bring down our positive case rates, there are communities that continue to have higher positive test rates. Some of those communities are also reporting a decrease in the number of tests that were being conducted, which is one of the main reasons we're targeting them for this new testing effort. Earlier this month, we launched our Stop the Spread testing initiative, which provides free, widespread testing. The first round of testing sites was launched on July 10th in 8 communities: Chelsea, Everett, Fall River, Lawrence, Lowell, Lynn, Marlborough, and New Bedford. The initiative in those communities is slated to run through the middle of August. So far, our data shows us there's been a lot of traffic at these testing sites. To date, providers have tested about 19,000 people at these locations. In the first week, the number of tests conducted in targeted communities increased by 48% compared to the week before. Statewide, the number of tests conducted for that same week increased by about 24%. We consider this a good thing because it means that more people are getting tested, including asymptomatic people who may not know they're infected. To date, we've received results back for about 17,000 of the 19,000 people who were tested. Currently, the data shows us that the average positive test rate for those test results was 1.8%. These numbers are obviously subject to change as we add in the last 2,000 tests and then build on that with additional tests as we go forward. Today, we're expanding the program to 8 additional communities: Agawam, Brockton, Methuen, Randolph, Revere, Springfield, Taunton, and Worcester. The second group of communities are reporting a higher COVID-19 positive test rate that's higher than the statewide average. Their testing volume has also come down, meaning residents are not seeking as many tests in these communities as they were previously. Together, these 8 new communities make up approximately 10% of the Massachusetts population, but constitute about 15% of the Commonwealth's positive tests in the past week. The statewide positive test rate over the past week, as I said before, is about 1.9% for the past 7 days. But in these 8 towns, the positive test rate was 2.3%. The number of tests conducted in these communities has also declined by over 20% since the end of April. Testing in these new communities and making it available to all residents will include those who are also asymptomatic. Please visit mass.gov/stopthespread to find a testing site near you and to find out how you can make an appointment to get tested. It's very important that everyone looking to get a test at these sites check with the website first. With these 8 towns coming online, the Commonwealth has now established sites in 16 communities statewide for free testing. In addition to other dozens of testing sites in every county, we're increasing our testing footprint to better understand exactly where the virus exists, who has it, and how we can follow up through our tracing program and other initiatives. With more testing and tracing, we can obviously identify more transmission, particularly for asymptomatic populations, and continue to contain the spread of COVID. If anybody believes they have the symptoms of COVID-19 or has been exposed, please stay home and stay away from others. Contact your clinician and visit mass.gov/stopthespread to see if there's a test site nearby that works for you. If there isn't, make sure your clinician works with you to find a place where you can get tested to determine if, in fact, you have the virus. As we prepare for the fall and ramp up stricter travel restrictions, more testing will be a pillar of the state's COVID-19 prevention strategy. We'll continue to bring every resource we have to bear and are grateful to our healthcare community and our frontline workers for their tireless efforts to contain and fight the virus. As I've said many times, COVID's not going to take the summer off, and neither can we. Every resident, every business has a responsibility to do their part to stop the spread. Please keep wearing your face coverings, socially distance wherever you can, and use common sense. That's how we continue to succeed in containing the spread of COVID here in Massachusetts. And with that, we'll take questions. Ted. Yeah. So the way we set this up was we have rules and protocols, and people are expected to follow them. If there are issues or concerns people have about whether or not somebody's actually following the rules and the protocols, we refer them to the local community that has direct oversight through its local Board of Health, and that's what's happened here. We've talked to the City of Boston, and the local Board of Health in Boston is reaching out to and conducting an investigation with respect to the cruise ship.
From a citizen standpoint,
So I think everybody in Massachusetts should be enormously proud of what they've accomplished over the course of the past several months in terms of turning the tide, bending the trend in the opposite direction with respect to cases, and reducing it down to a point where, since we started reopening, we've gone from about a 9 or 10% positive test rate at the point we reopened to the point now where it's below 2%. But the last thing we can do is start to think that means there isn't COVID in Massachusetts around and among us. I mean, we've stood here many times and talked about the significant portion of the population that is asymptomatic, both those who never show symptoms and those who don't show symptoms for the first 4 or 5 days that they're actually infected. The whole issue about wearing a mask, socially distancing, washing your hands, the hygiene, all those issues are all about the things that we can do as individuals to help manage the spread. And when the numbers came down and the weather got warm, I think we all got a little concerned that it would be more difficult for people to continue to demonstrate the vigilance that they've shown day over day, week over week, and month over month since April. And I can't express how important it is for everybody to continue to do the things, play by the rules, and use the guidance and the compliance that have been developed by the Reopening Advisory Board to ensure that we continue to fight the spread. We've never said we're going to get to zero without a vaccine. We won't. But the question about how much COVID we have and the job that we do managing the spread does come down in many respects to the individual decisions that get made by all of us.
Governor, the president of the Mass Medical Society last night tweeted that he cited those numbers that started to tick up, and he said we should consider backing down the phase. Your thoughts on that? Does he have a point?
I think at this point in time, the most important thing we need to do is to continue to do the things that got us here in the first place. When we look at what the clusters are that have been created so far, many of them are the result of people simply not doing the things we've been telling everybody to do, which has a lot less to do with the nature of what's opened or what's not opened. I think certainly the public health data is going to drive our decision making, but so far most of the data we've seen about where the clusters have come from have had a lot more to do with people just sort of letting down their guard a bit than anything else. The Chatham thing was a big outdoor party and private party in somebody's backyard. The Bay State thing was a result of somebody not really abiding by the mask guidance and criteria that existed at the hospital. I mean, most of the time, if people do the right things, we should continue to be successful in containing this. If people don't do the right things, obviously that's another story.
Other than getting up here and beseeching people to do those things, what can you do to get people to comply?
Well, in the case of the boat in Boston Harbor, there's going to be a conversation between the city of Boston and the boat about whether or not, in fact, they were abiding by the rules. We have lots of conversations with our colleagues in local government about various incidents and circumstances that they end up pursuing and investigating, and that's as we believe it should be.
Governor, on the topic of schools, a local think tank released a report criticizing your approach, saying it's too hands-off. Instead of giving districts a list of options, you need to be more specific in your direction and preferences, your response. And will you?
So first of all, I would argue that we've given more guidance and more direction to schools in Massachusetts than any other state I'm aware of, okay? Secondly, I think it was important from our point of view, given some of the uncertainties that are out there, that we encourage schools and school districts to work on 3 plans. The first one being a reopening. And I think, the pediatrician community, many of the public health experts, a lot of the folks in the infectious disease space believe that it's in kids' best interest for schools to reopen. But that said, it's also going to be important for schools and school districts, if they need to to be able to pivot based on the actual facts on the ground in each community, which means you do need to understand how you would do this if you were going to operate on a so-called hybrid basis, some in and some remote, either on a district basis or on a school-specific basis and on a remote basis. Because it may be that over the course of the next 4 or 5 months, you could have school districts that at one point or another are going to need to know how to pivot from one option to the other. And I think the guidance that we've given them with respect to how to build that, along with the $900 million that we've made available in state and federal funds to support the things that they need to purchase and acquire to implement this, sets them up pretty well to develop those plans. And I know the commissioner and his team have been in regular conversations with the superintendents, the teachers unions, and a variety of other interested parties, almost literally on a daily basis for the past few weeks. And those, I think those responses to the guidance that was offered by DESE are due in about 10 days. But I don't know why you would literally say to people, it's all this way or all that way, because circumstances over the course of a school year or over the course of the fall may require people to be able to do more than one.
With less than 5 weeks from school starting, do you feel good? And parents seem to be really concerned. And you said yourself, a lot of balls are up in the air.
I've heard from Lieutenant Governor and I both heard from plenty of parents, and parents are in a variety of places. Again, depending to some extent, I think, on their own experience. The same goes with respect to school districts, and that's again part of the reason why we think it's important for people to develop a variety of options that they're able to put in place depending upon the circumstances in their district.
Governor, on the travel restrictions, have you considered at all using the toll entries to see how many out-of-state drivers are coming into here, or has that not crossed your mind yet?
We've talked about that, but we haven't decided to do anything with it yet. I will say this: there were hundreds of thousands of hits on the state's travel website since we announced the travel guidance last week.
Did meeting with the Vice President, is there going to be any immediate actions or resources from what you talked with the Vice President Pence?
We talked a lot about testing. We talked a lot about the current debate in Washington with respect to sort of the fourth coronavirus relief package. And I think I made a pitch that's pretty similar to the one a number of governors have made about how important it is for the feds to continue to make the sorts of investments, especially in municipalities and state government, and some of the issues around testing that are going to be critical to our ability to do many of the things they would like to see happen. Continue to expand our economies, continue to broaden the testing and surveillance capacity we have, and to be able to come up with strategies and plans with respect to reopening schools. Those are all things that I hear Democrats and Republicans in Washington say they want to do. For us to get from here to there, it's going to be important for them to help us do that.
Did Pence make any commitments along those lines?
He's one player among many. So, I mean, I had about an hour with some of his staff and about a half hour with him. They gave us a lot of time and plenty of opportunity to make the pitch. And I've said for a while that I'm optimistic that that both the House and the Senate will find a way to get to yes on this. I mean, I've had a lot of conversations with Congressman Neal about this too, as well as several members of the U.S. Senate. But I think, like many people, I would like to see it happen a little quicker because the clock's ticking, and I am especially concerned about the folks who are part of the UI system for whom they are very much up in the air with respect to what their benefits are going to be going forward until those folks act.
Governor, I made a huge trip back today. The team's testing positive, kind of closing down. A lot of room to stay positive. When you threw out the pitch of the NFL, were you looking around and say, wow, did you ever see fans in the stands this season? And thoughts about how it worked out this season?
So, I mean, Major League Baseball, I remember when they sent us, Secretary Sutters and Lieutenant Governor Polito and I got a look at their protocols for opening up the season. It was enormously detailed, and it involved continual testing. And I think to some extent we're going to see the impact of that continual testing over the course of the over the course of the season, and it sets a very high bar with respect to when you play and when you don't. And that's going to create some disruption in their schedule along the way. I think our view is their approach to this is to be careful and cautious, and if that translates into some games not getting played, or some games being postponed, or some trips not being taken because of issues associated with the results of their testing, that's going to be the way it's going to be. I did find Fenway Park is a cavernous place when there's nobody in it. And I was actually kind of glad that they were sort of pushing in some kind of baseline crowd noise, because without that crowd noise getting pushed into the thing, I mean, every single sound in that place echoes off all four walls, and it would almost be like playing baseball in a closet. So I'm glad at least they took care of creating some kind of baseline sound in the place to give it at least some modest sense of normalcy, I guess. Yeah.
The housing choices, your language is in the House Economic Development Bill. They're probably going to pass today. Has the legislature come around to your thinking on that? A surprise, at least.
Look, I think the Lieutenant Governor and I have been talking to municipal officials and others in the housing community for 3 years about the slow pace of housing construction in Massachusetts and the impact it's been having for decades on the cost of housing generally. And I think there's a lot of downsides to sort of the impact of coronavirus generally. But certainly one of the things that I think most people have figured out during this period is how incredibly expensive and sort of underdeveloped our housing stock is generally. And I think one of the things I'm hoping comes out of this is a piece of legislation that will make it possible for us to build a lot more housing of all kinds faster. And we signed the largest housing bond bill in state history a couple of years ago. We have a lot of dry powder to put to work, but the pace at which we have an opportunity to put that to work is incredibly slow relative to the need and the demand. And whether you're talking senior housing or affordable housing or workforce housing, the rules of the game in Massachusetts are set up to go at a pace that makes it virtually impossible to keep up with the growth in the population and the changing needs and expectations of many communities. And, you know, this bill's supported by the affordable housing advocates, the senior housing advocates, the cities and towns, practically everybody. And I really hope that that this happens as part of the economic development bill, because we desperately need to create more housing because we don't have enough and the stuff we have is way too expensive.
Governor, would you want to see the legislative words about passing of 7 news on finance?
So, I mean, the great thing about Ed Anson was, you know, I've worked in state government and local government, same with the secretary and same with Lieutenant Governor Polito. We love state and local government. We love sort of the atmosphere and the vibrancy and the intimacy of it. And boy, did he love local TV. I mean, Ed Anson was one of those guys who just thought local TV was close to the people, it was close to the communities that it served. You could literally almost touch and feel the folks that you were trying to serve on a day in and day out basis. And he did an incredibly gutsy thing by launching a local news station, which I don't think had existed prior to him doing that anywhere in the country. And I think we were way better to have somebody like that who cared so much about serving the people of a community, of a commonwealth, and focused like a laser on that. And the other thing I'd say is, you know, his family's been incredibly generous over the years to all kinds of organizations, and especially those that serve kids. And his enthusiasm for what he did and who he was serving and what he thought local news was supposed to be all about will be terribly missed.
Governor, do you expect that, or would you like to see the legislature extend its session?
So, as a general rule, the lieutenant governor and I try to stay out of giving the legislature advice about what it should or shouldn't do with respect to its own activities. And that's where I'm going to stay today. I will say that, we still have to figure out how to deal with whatever comes out of the federal budget discussion to create and sort of finish our own budget activities. And there are a lot of things that are still in process that I think are important to many of us. The economic development bill and housing choice is one. There's a transportation bond bill that has a lot of really important elements in it. It's another. The whole debate and discussion that they're currently still in the middle of with respect to policing and law enforcement is still going on. There's a bunch of things that I think we would believe would be good things to get settled. Whether or not they can get settled in due course, that's really, the end of the session is always a little bit of a traffic jam. And I guess we'll just have to wait and see how it plays out.
Thanks, everyone.
Thanks, everybody.